When we discuss about hernia surgery with the patients, they are concerned about the recovery time, the pain after the surgery, or return to their activity and exercise, as most of the patients or the general population is health conscious and they would like to return to the gym and exercise. After an open operation, generally one can expect to have pain for 4 to 7 days, and we generally recommend to them not to do any heavy physical activity at least for 4 to 5 weeks after surgery. After laparoscopic totally extraperitoneal repair, my recommendation to the patients is to take it easy for the first 3 or 4 days and do light exercise and activity so that the healing period is over. And once they're comfortable, which is done generally day 4 to 5, they can start driving once they're completely comfortable, which could be variable in patients, and some of them may take a touch longer. And if there was a problem or a complication, it can take up to a few weeks as well. But in majority of the cases, day 4 to 5 is the time. I do not restrict my patients from any exercise or activity because the technique that I use is safe, and this does not have the risk of the complication of a port site hernia, which is a major concern after keyhole operations. The incidence of port site hernia is extremely low, but with this technique that I use for my patients, the risk is almost next to negligible. The mesh that we place to secure the hernia is much larger than the size of the defect, so there is no risk of lifting heavy weight and getting a recurrence of the hernia because the coverage for a small defect is ample and one can resume one's activity as they feel fit. As far as the mobility of the patient is concerned, after laparoscopic surgery, they can sit, get up, and swing the body sideways like if you were playing golf or any other sport on the day of the surgery, which is not possible after open operation, even up to 2 weeks or so after operation. So by far, the parameters that we have for recovery are mobilization, post-operative pain, post-operative light exercise, return to driving, return to activity, and return to work. These are much better after a laparoscopic totally extraperitoneal repair than an open operation. The other considerations or the comparison between these two operations is the risk of recurrence and chronic pain or chronic numbness in the groin. Again, laparoscopic approach is much better than open approach in all these cases as well. And that's the reason why it is recommended by National Institute of Clinical Excellence in the United Kingdom, NICE. And the two studies, or the two decisions by NICE on hernia guidelines which were done were they had partially come from our center in England as well, from Royal Surrey County Hospital, where Professor Michael Bailey, the then president of Association of Laparoscopic Surgeons, and my boss, he presented the evidence. And our work was considered to prove that the laparoscopic approach was much better than open approach for hernia repair. Now this is considered as a standard in all the developed countries. However, due to lack of training of surgeons and various other issues, unfortunately in Britain, still 80% of the hernias are being done with an open approach, which is not a great service to the patients. If I had a hernia, I would definitely choose a good surgeon and get it operated laparoscopically. I would never let them do an open approach on me. I'm from the generation who did a few thousands of open operations before performing laparoscopic, so I'm very comfortable with both approaches. So probably I'm in a good position to comment on the benefits of both approaches to a patient. And my preference would be for a laparoscopic totally extraperitoneal repair to the patients with unilateral, bilateral, or recurrent inguinal hernias. Even if the recurrence has happened several times, one can always approach this with minimal invasive approach.